Hi everyone, welcome to this session. We're going to look at the fast track pathway now. So we're going to run through the document. You can see it's quite a small document, but by the end of this session, hopefully you'll have a really clear idea about the fast track pathway. So what is the fast pathway tool? So it was revised to accompany the National Framework for Continuing Healthcare, and that's that big document. It's the 182 document. I've done that as an MP3, so you can listen to that document in full. You do need to understand that document, so either read it or listen to it. And it also supports alongside the checklist for the decision-making tool for continuing healthcare. And also, this is the version that the Integrated Care Boards and NHS England should be using, so we know that's the most up-to-date one. And in conjunction with the national framework, so that larger document, you need to look at paragraphs 240 to 269 for the fast-track pathway processing. And again, you should have received appropriate training. So again, this is what this is. The idea for this is for individuals that are rapidly deteriorating and entering the terminal phase. So if you're thinking about end of life pathways, then obviously the fast track tool is the one that you need. The intention for the fast track pathway is that it should identify individuals who need access to continuing healthcare quickly to minimise the delay without the requirements to complete the checklist or the decision support tool. Therefore, complete the fast track pathway tool with the evidence that the person has primary health needs that are rapidly deteriorating and a condition there where they need that additional support. So who can complete the fast track pathway tools? So again, in fast track cases, the standard rules state that an appropriate clinician who has determined that the individual has primary health needs, so the ICB board must therefore determine that the individual is eligible for continuing healthcare and should respond promptly. So again, here we can see an appropriate clinician is defined as a person who is responsible for the diagnosis, the treatment or the care under the 2016 Act. So a registered nurse or a registered medical practitioner. And the appropriate clinician should be knowledgeable about the individual's health needs. So in other words, the person that's done the diagnosis, you are going to be asking for them to complete that fast track process there. So again, it could be any of those three there. An appropriate clinician can include clinicians employed in voluntary and independent sectors, have specialist roles and end-of-life needs, for example, in the hospice, providing they're offering services in line with that 2006 Act. Others who are not approved clinicians, as defined above, are involved working with end-of-life needs. And again, here, many identify the fact that the individual needs for which use the fast track pathway tools might be appropriate. And again, they should contact the appropriate clinician who is responsible for the diagnosis. So it's very clear here, your roles about contacting them to complete this. So when should the fast track pathway be used? So the fast track pathway tool must only be used when the individual has rapidly deteriorated conditions and entering those terminal phases. The fast track pathway tool replaces the need for the checklist. We've already discussed that. The fast track pathway can be used in any setting. So this includes such support is required for individuals in their own homes, in care homes, and people that wish to remain there, such as the hospice. If an individual meets the criteria for the fast track pathway tool, then the tool should be completed even if an individual is already receiving care packages. The completed fast track pathway tool should be supported by prognosis where available. So again, we need the diagnosis and the evidence to support the fast track pathway. And again, this should clearly show or state that the rapid deterioration and then some kind of anticipated end of life judgment there. And the fact that they may be entering the terminal phase is not intended to be restrictive to those. So again, I think that's the most important bit about this document is it's the fact that you think they're going into the terminal phase. They don't have to be in the terminal phase, but you just have to have reason to believe that they're going to that phase. It is the responsibility of the appropriate clinician to make the decision based on whether the individual needs meets the fast track criteria. So any individual may, at the time of consideration, be demonstrated few symptoms, yet the nature of conditions is such that it is clear that rapid deterioration is expected in the near future. So again, that's the bit about that. Okay, they may not be there at the moment, but in the near future, they absolutely will be. Because I'm sure some of you have assessed people and within a couple of days they've bounced back and all the clinicians are there and you're like, well, it was on the cards, but it just didn't happen. How should the fast track tool be used? So here, appropriate clinicians should complete the attached fast track documents as set out how their knowledge and evidence about their patient's needs. It's helpful there to obviously put the setting included the fast track pathway tool. Once completing the fast track tool pathway itself, it's sufficient to demonstrate eligibility, so we just make sure that we're meeting those criteria. And the setting where an individual wishes to be supported. So again, where they want to be and how that's going to happen. How should the individual and representatives be involved? So again, this is the working together part. The overall fast track process should be carefully and sensibly explained to the individuals and, where appropriate, the family members, etc., who are going to be involved in those decisions. It's also important that the ICB board to know about what the individuals and their representatives have advised about the condition. So what do they know, what do they not know? Because obviously, are they aware that the patient is on an end-of-life pathway? Clinicians completing the fast track pathway tool, I can't say that for some weird reason this morning, makes the individual aware that it will be important to review the individual's care needs and that the effectiveness of the care arrangements in doing this. So again, just making sure that needs are being met regardless, following that national framework, and again with reference to that paragraph of 264, 269. There are a number of principles which underpins the NHS continuing healthcare process. Most importantly, the assessment and review should always focus on the individual's needs and follow that personal-centered approach. And we said that in the other recordings and throughout the training, so we're aware of that. In the spirit of being personal-centered, the practitioner should make reasonable efforts to seek the participation. So again, just making sure that everyone's involved through the process and again, understanding any decisions that have been made. We understand about consent. Again, in the national framework, it talks about consent, looking at paragraph 85. So does the person have capacity, they not have capacity? And again, who are the next power of kin or the advanced decision makers for welfare, health, finance, etc. It's also necessary to obtain individuals' consent before sharing personal data. So we know all of this stuff. And again, around the Mental Capacity Act. So careful decision making is essential in order to avoid undue distress that might result in changes in the NHS continuing eligibility with a very short period of time. So let's have a look at the tool. So again, same as before, we have our name, date of birth, date that's completed, the NHS number, their addresses, their agenda, and then contact details of the referring clinicians. So at this point, it does say who is the registered person making that decision. Fast track pathway tools for the NHS continuing healthcare there. So here, it is what it says on the tin. You just follow the form and fill it in. So here, to enable individuals, the package of NHS continuing healthcare, the individual fulfills the following criteria. So here's the criteria. They have a rapidly deteriorating condition, and the condition may be entering a terminal phase. For the purpose of fast track eligibility, this continues a primary health need. No other test is required. So it's as simple as, are they rapidly deteriorating? And do you think that they are entering the deteriorating phase, that terminal phase? So, brief outline for the reason of fast track recommendation. So here, please set out below the details of your knowledge and the evidence of the patient's needs. That means you need to consider that they are fulfill the criteria. So in other words, you need to respond on the deteriorating condition and then the terminal phase. So what makes you think they're going into that terminal phase? This may include evidence from the assessment, diagnosis, prognosis, if they're available, together with details of both immediate and anticipated future needs. So again, just having a look at that. So we pop that in there and just answer those questions. So those bits, assessments, diagnosis, prognosis, is what I would be commenting on there. Please continue on a separate sheet if necessary. So obviously, if you need more space, put more space on here and then here. It's just a confirmation. So I am an appropriate clinician. Confirm that I have explained to the individual there and the representatives. So fast track application for continuing healthcare. So it's that one. That the purpose of this eligibility for the individual's needs is urgently met as they have a rapid deteriorating condition and may be entering the terminal phase. And again, you know, it may be entering the terminal phase. It's not saying you definitely are, because sometimes it can be quite tricky. And their needs and the effectiveness of their care arrangements may need to be reviewed. So again, just looking at that there. So we should be ticking those. Again, the clinician should be signing, and then that's obviously sent to the board. Finally, you have your equality and diversity monitoring form. So once you've completed that form, you're going to email that over to the ICB board. And obviously, that should trigger that continuing pathway finance for that individual to ensure that they have the right care and support towards the dying stages. So that's the summary of that form. Again, nothing too terrible there to go through in a paperwork wise. So the takeaway from this is they must have a deteriorating condition and they must be entering the terminal phase. So that's the evidence that you've got. Three things that you want to really cover in there was the assessment, prognosis and diagnosis in the form. And again, this is obviously the version that the Integrated Care Board is using to make those decisions. So just making sure that you know where you're emailing that once it's completed. Equally online, they have this in an easy read format. It's down to you to obviously have those discussions with the family members, and that's where your clinical skills come in about arranging the meeting, being sensitive, sharing the data. And whilst the form is relatively straightforward to complete, it is the complexities around the form. So it is about being sensitive about those end-of-life decisions that you're making for somebody. It is about making sure that you have consent, that the person understands what's being done about them. And it's really important that obviously those decisions are recorded and there is evidence that that's been done. Furthermore, think about the personal care planning principles, just making sure that when you're writing your recommendations, that that's done from a very personal centered point of view. And at that point, it may be as the clinician, you want to work with healthcare advisors, continuing healthcare assessors, or whatever it is, to gather that evidence to help complete that paperwork and those recommendations and outcomes for the individuals. So again, there's absolutely no reason why that can't be a multidisciplinary decision on what's best for that individual, because that's following PCCP principles. Anyway, thanks for watching. Any problems, let me know, and I will see you in the next video.